Let's speak to this Transport Secretary Grant Shapps here on behalf of the government this morning. Good morning. Thank you for finding us. It's good to have you in the studio. Let's deal with the data to start with. As far as the Omicron variant is concerned, how many people in hospital this morning?
With Omicron, the last figure we had is unchanged. The 10 people in hospital. We know there's been a single death, and we know there's probably around 9,000 people who have tested positive at this stage.
How many on ventilators?
None on ventilators that I'm aware of, although I don't specifically know the condition of the 10 in hospital, so there may be some of those.
The person that died, did they die having gone into hospital with Omicron, or did they...
Again, I don't know the specific details of that individual's
So does that suggest we've got this under control?
No. I mean, what we do know is that it's doubling every 2 to 3 days, which is incredibly fast. And the thing about doubling rates like that is you can go from seemingly almost nothing, of course, to suddenly it becoming a thing which overwhelms you. And I think that the hospitalisations are, in many senses, a lagging part of this, because we know from coronavirus as a whole, it takes a while, 2 or 3 weeks, before people find themselves in hospital, and sadly another 2 or 3 weeks before people die. Although, of course, we hope it might be more, less severe. We just don't know whether it is at this stage.
Well, Dr. Angelique Coetzee, as you know, South African scientist, saying the UK is being alarmist in its response.
Well, I'm surprised to hear that. And actually, I know there are different voices in South Africa, and I've listened to a lot of them. If you look at South African hospitalisations, you see that very, very quick, as I say, the doubling rate becomes an issue. And I was having a look at the data on this just yesterday morning, and you can see the speed at which people are going into hospital. Now, there are all sorts of arguments about how severe it is, how long you spend in hospital. The big problem that we want to try and avoid is having our hospitals so full up that when it comes to you needing to call, for an ambulance, accident, emergency, elective surgery, that you can't get into a hospital to do any of those things. And it's our responsibility, obviously, as a government, as a country, to make sure that that doesn't happen.
Yeah, although there are only 9 in hospital, aren't there? Sadly, one person.
But this whole thing's only a couple of weeks old at this stage.
Well, it's not, though, is it? We've known about it since October.
Well, in terms of the number of people having it here, we know that,
The first case was in October.
Of course, but if I look in the last...
that's 3 months ago.
Sure, but if I look in the last 2 days, for example, I can see there's 3,000 or 4,000 new cases right at the beginning of this, and let's call that the beginning of December, when we first started to pick them up here. The cases were increasing at just 2 or 3 a day. Mm-hmm. So you see what happens. The doubling rate means that if you don't act, you'd be the first person on your programme to say, why didn't you act sooner?
Mm. Do you recognise the figure of 200,000 a day contracting COVID?
200,000 a day is based on the fact that people get tested, and when they're tested, they're included in the official cases. But the Office of National Statistics and others have always made estimates of what the likely total amount of coronavirus is, and that includes people who haven't necessarily received a positive test as yet.
A Cambridge statistician, Professor Spiegel-Holzer, says that's just naughty without context.
Well, again, I think it does need to be used in context, and very clear about it. There's a difference. If you take a test and that test is positive, then that gets included in the data. But there are other organisations, including the Office for National Statistics. Coincidentally, my family has been on the Office of National Statistics monthly survey right since the beginning of coronavirus. It was randomly selected, I suppose, and they do those wider surveys. Now, they do those tests monthly on the whole population to take a sample size, so people are so you've got a regular baseline for these things, and that's how these estimates of what it might mean in the wider population come about through those significant sample sizes.
More figures reported in the newspapers this morning. More than 1 million people could be in isolation by Christmas Day. Is that a figure that you recognise?
Well, look, I hope it's the case that all these steps we're taking, most significant of all, getting people boosted, means that we don't end up in that kind of situation. The frightening thing is if you do nothing, if it doesn't turn out to be less severe than we think, or we hope, if we just left it to chance, as I've already said, you'd be having me in the studio.
So you don't recognise those figures?
Saying, well, we hope to avoid anything like that, of course, yeah.
In the meantime, the last 3 days I've gone on to the NHS website to look for the lateral flow tests. That they're not there. That's a supply issue.
Yep.
Should we be prioritising care home residents and NHS workers so that NHS workers can go to work and care home residents can have visitors.
But first of all, just on the tests themselves, these lateral flow tests, which actually uniquely, and as far as I can see, there aren't other countries who've been supplying these free of charge to their citizens. Major economies haven't generally been doing this, and we have in this country. You're right that particularly since the new measures, the booster programme asking people to be tested has come in, it can be difficult at different times of day to get those. I did notice yesterday, actually, that at certain times of day you could get them. They're coming back in. There's plenty of supply in the country. What we're having issues with is the distribution route, and I know my colleagues at the Health Department are working with Royal Mail, with Amazon, with others to try and make sure that distribution gets out.
But should
and you
we
can still go to
prioritise
pharmacies.
Well, they also say potentially not. Should you be prioritising care home residents?
Absolutely. I think, care homes, hospitals, very, very important. And most important of all, if there's one single message from all of this, boosters. 24 million people boosted already. I saw huge queues, I walked past huge queues yesterday of people responding to what the Prime Minister said on Sunday night and going in, booking and waiting for many walk-in centres.
You can't say the Brits are not doing their bit. They certainly are queuing up for hours and hours. The Scots are saying the public should be limiting socialising to 3 households at a time in the run-up to Christmas. Good idea?
Well, look, every part of the UK will have a look at this and then they make their own plans. The Scots, I think, have issued it as guidance rather than law in their particular case. We set out in England, for people watching this in England, what we want to do. Parliament's now voted on it. And right now, that does not include limitations. We want people to be able to enjoy Christmas this year. We're certainly in a better position than we were this time last year.
So the Scots can do that, but the English are not doing that.
Yes, I was going to say, it's only in guidance in Scotland, but that's right. We want people to be sensible, but to enjoy their Christmas, to get tested. And we have 2 things this year, which we didn't last year. 1's tests and 2, jabs, and now even booster jabs. That's all happened in the last year, so we're in a much better position this Christmas.
OK. Everybody I talk to, Minister, says to me, when you get that Minister on your show, can you get them to guarantee there will not be any further restrictions ahead of Christmas?
Well, look,
Dominic Raab yesterday said there won't be as long as it's this variant.
Well, look, I know that we've taken a huge number of steps. We've already got over 40% people boosted. People watching this can help by making sure they book their booster jab if it's been 3 months since their second one, and that way we can all enjoy Christmas. And so I think with some confidence we can say that people are going to be able to enjoy their Christmas, get together with their friends and families.
And no more restrictions.
And with only what has already been announced. That's right.
Will everybody be jabbed by New Year's Eve?
Everyone will have been offered a jab who wants one.
Are you sure?
That's the plan. It depends somewhat on your viewers, of course. People have to actually come forward. We can't make people do that.
But everyone who wants one will have had one by New Year's Eve.
Offered a jab. I imagine that some people, for various different reasons, may get their jabs in the new year, where, for example, they're having to wait because it's more than 3 months, and for whatever reason, less than 3 months, and they didn't have their second jab until whenever. So obviously, some people will still be coming through the system. The key thing is everyone to be offered a jab. And as we're seeing, again, there's no other country I'm aware of, certainly no other major economy, where over 40% of their citizens have already had the booster jab. We got the original vaccine programme done first, and we're getting this booster programme done first, and that will give us better protection, including against Omicron.
And when will the third jab be an absolute essential to get into places that we agreed to, that Parliament agreed to yesterday? So big gatherings in the London.
Not this year. Because
February is the date, I'm told. Is that?
I think we'll have to see what the evidence shows us nearer the time. I think your question's hinting at, will there be a time at which 3 jabs is then saying that you're fully vaccinated?
Wasn't a hint.
It wasn't very soft.
No, it was definitely not a hint.
You're right. And look, I speak to my opposite numbers in other countries, transport secretaries from around the world, particularly from the G7 this year, which we're hosting, and they're saying, look, we're going to switch to requiring people to have that third jab before they're able to come into their countries. So I think eventually it becomes inevitable because other countries will require it for us.
You just don't know when.
Yes, and I don't know what that time will be. Not this year, as I say, but right now,
potentially
get yourself
February.
jabbed.
OK. Let's talk about this Tory rebellion. Dominic Raab told me yesterday, Deputy Prime Minister, sat just there, he said he'd be surprised if the number was as high as 70. It was almost 100. You've lost the dressing room.
Well, I'd say nobody wants to curtail people's freedoms, and MPs rightly take that very, very seriously and have to think about how they vote. In the end, Parliament passed these measures with a majority of nearly 250, but each individual MP has had to think it through very carefully, and I completely understand that. We don't want to have to put these steps in place. On the other hand, as I've said a couple of times, we don't want to afterwards end up having to look back and wish we had.
It's not answering my question.
How so?
And you've lost the dressing room. Even even an MP that is the newest MP that happens to be a Conservative MP, and even he voted against the Prime Minister.
Well, as I say, losing the dressing room would be Parliament not supporting you. Parliament has supported these measures, You
had to rely on Labour, though.
Well, if Labour hadn't voted, they still would have gone through, of course, but based on the numbers. But that's not the point. And I do appreciate that every MP has to think very carefully. And look, particularly as a Conservative, I hate the idea of curtailing people's freedom to act and to do different things. As it so happens, we've actually managed, because of our vaccine programme and booster programme, to be one of the most open of certainly European countries. In most other places, including, for example, in France, you have to show vaccine certification just to get on a train long distance.
Yeah, we're talking about here.
And but we've not had to bring those things in here because of the booster programme.
Yeah.
And I think it's really important that we keep reminding all of us that the way to prevent having to do these things is to make sure we all get our jabs and boosters.
What if you lose the by-election? Will you have lost the dressing room then?
Well, look, governing's difficult. And you don't have, there's especially with something like coronavirus, there's no text, but there's no manual to work through. And I think, this government will have done some things where we haven't got it right, and looking back through coronavirus. We've also done some things where we've absolutely got it spot on.
What if you lose?
And as I say, things like the vaccine programme has been one of those. In mid-Parliament, all sorts of different things happen.
So you're shaping up to potentially accept that you might lose? When I was having these conversations 2 weeks ago, it was absolutely not going to happen. The bookies have said you've got no chance. It's the Lib Dems.
Well, look, one thing I've known for being in politics for a while and having been party chairman is never to become the pundit on your sofa. You've got plenty of guests who'll do that. Why don't we leave it to the voters of North Shropshire?
But you're preparing for potentially losing.
As I say, I don't want to preempt what voters decide to do. That's their business, and I'm sure afterwards you can analyse the results, or I'm sure there are plenty of people to do that for you. What I do know is that people in North Shropshire have the opportunity, and I've met the candidate, to vote for a potential MP who worked very, very hard for their area. And I know about all of his transport priorities because I've been up to see them. OK,
let me ask you another couple of questions before I let you go. These Downing Street parties, they just won't go away, will they? Sean Bailey's resigned from his role as chair of the London Assembly Police and Crime Committee after that picture. Did he do the right thing?
Well, absolutely right thing to resign, but the wrong thing to have held a party. I mean, I point out this is not this is something that was organised by I guess is London.
Doesn't matter who organised it,
campaign team.
Yeah.
I see in that picture apparently 4 Conservative Party workers who are on secondment where disciplinary action has already been taken. And to answer your question, it's disgraceful to have a party like that break the rules. That's unacceptable, and the consequences that follow.
So if he stepped down, what about the Prime Minister? He was ringmaster over a quiz with names like Professor Quiz Witty, Hands Face First Place, Next Slide Please, and the participants were told to go out by the back door once it was over.
Well, come on. I saw the photo you just showed shows a lot of people not socially distanced, absolutely unacceptable and disgraceful. I saw the photo of the Prime Minister's so-called quiz.
Who was he on the Zoom with? That was him, but who was he on the Zoom with?
He was sat in...
And he was reading out the names of the quiz of the teams. Hands, face, first place. Come on, Prime Minister.
Hold on a minute. He sat in front of a computer thanking his staff for 10 or 15 minutes for having worked through Christmas on a virtual quiz.
You did a round. You did a quiz round.
I don't think there's really an issue. As far as I'm aware, there's no issue that I'm familiar with where you can't have quiz names over the video screen at Christmas. I think that's all getting a little bit silly. The other picture you just showed, well, that is obviously very
OK, there's lots more to ask about that, but we're over, so I just want to ask you briefly before I let you go. As a parent, how can you reconcile the abuse that children are facing as a result, some would say, of lockdown? Those 2 babies, the images that we've seen, I can't even begin.
I actually, I said to my wife, as a dad, I said to my wife, I actually can't read the detail. I had to force myself on that first picture. It's heartbreaking, actually heartbreaking to see it. And, you know, lockdown or no lockdown, obviously there's no excuse. I know that my colleague Nadeem Zahawi, the Education Secretary, is looking into this and announced
Inquiries are not enough, though,
I know there is nothing that will bring that back, and it is, you know, difficult to see it in any other way as just pure evil.
Yeah, and this was the little boy last week as well,
It's
Albie.
heartbreaking, absolutely heartbreaking. And every parent in the country will be reading this and seeing this story this morning and feeling the same way.
I must let you go. It's great to have you in the studio finally. Come back soon. Thank you very much. Thanks a lot.